guys introduce yourselves for those who are unfamiliar with you, and we can just like jump right on into the discussion. What I hope is for people to feel enlightened, feel encouraged, and if you have some questions, I will definitely try to jump in between and answer some questions for you guys, but multitasking and I do get engaged in the conversations, but I will try. Okay. All right. So you guys go ahead and start and introduce yourselves. Let us know, what are your credentials? Let everyone know, what was most impactful in your career and what you're doing currently.
Okay. So I'll start. My name is Dr. Tiffani McElrath. A lot of my patients, I let them call me Dr. Mac because I understand McElrath it's a mouthful basically. That's a lot of syllables. So I go by Dr. Mac with a lot of my patients, or they call me Dr. Tiffani. I'm not pretentious. A lot of my patients, they feel like they can trust me, and I feel like it's a two-way street. I think it's a symbiotic relationship where we got to trust each other. So just a little backstory. I was originally born in Shreveport, Louisiana. My parents met at Grambling State University, and they got married really young. My mother had me at 19, and my father had me, he was like 21. So they got married really young, moved to Dallas, Texas. I wish I could say I can experience it right now. I can't wait to go visit sometime soon, but I was living in Dallas, Texas as a young child. And when my parents got divorced, moved to Michigan. And that's where my mother, she got back on the good foot. She got help with my grandmother, who at that time, the automotive industry was booming in Detroit. Right. And so my mother needed help with raising me. My grandmother, she was very important in my life and my upbringing. So fast forward, I grew up in Southfield. I went to Southfield High. So did Dr. Thompson. And that's where we actually met. And went to Michigan State University, and I obtained a bachelor's of science in physiology. I didn't go that route first. At first I was human bio. So physiology actually added on an additional year to my studies, but that was fine. I actually was really intrigued with physiology and how the body works. So received my bachelor's of science in that, and then I went to University of Michigan, who is the #1 dental school currently, and I'm proud to say that. And I completed my doctorate there, a doctorate of dental surgery. And then I went on to Howard University, and I completed a residency program, an advanced education and general dentistry program. And I had the time of my life at Howard. So that's a little backstory about me. Currently, I'm working at an FQHC as a federally qualified healthcare clinic. And there's many different paths you can choose in dentistry. I chose this path. I chose to give back and to serve the underserved. And in return, I do get my loans repaid. So I'm just 10 months shy of my loans being forgiven. I'm thanking God for that. Unfortunately, they do not count like residency programs towards that. And my first year of practice, I was not thinking. I just practiced that first year, and it didn't count. But yeah, long story short, I'm working right now at an FQHC, and I love it. I love giving back. I love serving patients who look like me or patients who don't look like me. I think it's important for them to see me as well in this profession. So yeah, representation matters, as you said.
For sure. Same for me. You see a lot of women in physical therapy. Actually, physical therapy was started by women in the war times, and but you don't see a lot of Black women. And I've always strived to make sure that, you know, I can be in a position in every industry that, you know, people that look like me, that I can treat them, but also that they understand that we have a common ground, but also I am trying to help you and to help you move forward in your recovery. So for me, I started physical therapy because I had physical therapy. I ran track in high school and I had some injuries and I was intrigued by it, and knew from the jump that's what I wanted to do. So I went to South High, went to Michigan State, studied kinesiology at Michigan State, and then went to Oakland University, where I studied sports medicine and received my doctorate in physical therapy. From there, I got pretty much more intrigued with the sports aspect because of some of the patients I saw during my clinical rotations. I actually finished my last rotation in Miami, which was probably one of the best experiences that I had. Now, I didn't really love Florida, but I loved my job and the patients I got to see. Treating athletes is a whole different realm. Because these patients are patients that don't get pain until the 15th mile, or after they swim 25 miles or whatnot. It's a different area, so it challenges you every day. And not to mention, you know, tweaking technique, tweaking how things are done can change the whole aspect of how they perform. And so you have to make sure that, you know, you are trying to help with recovery, but not also making major differences in how they're, you know, doing things. Additionally, the mental aspect of the athlete is a whole nother ball game. And especially those that are at that higher level, it's a mental game. And any athlete that you come across, especially in the collegiate and professional realm, they can tell you, you know, the mental game and trying to prepare for competition is something that is more than some of the physical aspect. And I think that's probably one of the biggest parts that I have enjoyed, but also have been challenged in. I come from a family that is all social workers or psychologists. And so I was always around mental health. My parents are very expressive and, you know, wanted us to always express ourselves. And so I use that with my practice because especially with teenagers, you know, they don't talk a lot. And they won't say necessarily, even some of my, you know, professional athletes won't say what hurts or why it hurts because they know they got to perform. And so they don't want you to, you know, take them out the game or to limit them. And so they won't necessarily tell you, but I can tell by how you're moving that something is wrong. So using some of those techniques that I even got from my parents and some of my even friends is like, oh, okay, I can use that, because we also had, and I'm pretty sure you guys too had to take some psychology classes as well. But I use that a lot. I see that it's a very big aspect of recovery. You know, the pain aspect is so more intertwined with our bodies, but also our mind and how we perceive pain. And I think that's the one aspect that, you know, we don't spend too much time on in medicine, but we should, because people perceive pain differently. Because I say I'm a 5 out of 10, that doesn't necessarily mean it's a 5. It could be really probably an 8, but I handle pain differently. And making sure patients are able to realize what they can do functionally with their pain levels and managing that as well. So I've enjoyed physical therapy. I work in the city. I used to work, now I'm about 10 years in the city, but in the beginning of my career, I was in the suburbs. So I noticed a difference with patients, obviously, but also with
we lost your audio.
We can't hear you, Doc.
Yep, we can hear you now.
Yeah, we can hear you now.
So yeah, I think that there's definitely a difference between the areas that you work in adjusting how you perceive and how you present information to patients.
Very true. True.
Can I chime in with that, Doc? So when you were talking about pain, now I don't like to cause pain, but I like pain. And you want to know why I like pain? because pain is the number one motivator to actually get someone to get up and do something.
Right.
I see it so much in my profession where children and adults, they just become resistant to pain. They say they're not in pain, and when we take x-rays, I'm amazed. I'm seeing abscesses and they're denying that they're in pain. And so, like I said, if there's no pain, it doesn't draw anyone to go and actually get an exam and do the proper follow-up appointments that they need. So I agree with you as far as I believe the same with athletes, the same with patients. It shouldn't be a situation where because now you're in pain, you're willing to now and go get checked out. And that's the importance of having an annual dental exam every 6 months. So that way you can be proactive. The point is to be in front of the 8 ball, not behind it. So, that pain aspect, that's a big one right there. Because that's
so you guys really just jumped right on in. Wait, I mean, you guys you don't play. You can tell the profession you're in. It's like, let's get this going. So just before we jump into some of the pressing issues that we really want to enlighten the community on, and just like really give some key points to identify what we think, what disease process should warrant more information, more advice, more recommendations. So we're going to jump into that. But for the people who are joining, if you're not familiar with me, I am Dr. Natasha. I'm a nurse practitioner. I attended Murray Wright. I also attended Wayne State University, and I attended Oakland University. I did I did a degree in communications and went back, leading all the way up to my doctoral degree. And I've worked for the homeless population. I've been inpatient, outpatient, home care. I've did a lot. I've been in the healthcare industry since I was 18 years old. So I really started at the entry level and worked all the way through. Also, I had like very encouraging women in my family. My parents, they were very involved, really enforced education. I'm really thankful for that guidance. I had women in the family that were nurses as well. And in addition to that, I currently launched a med spa in California. I will definitely welcome you guys out for the Winery Day and some facials, whatever it is. But we would definitely make a day of that, right? And so I just want to thank you guys. I know, we all have such busy days, but it is very important for us to take time out and pour into others, just as, we've received our education, our experiences. And so people really appreciate when people are able to give back and pour into them and try to enlighten the community and take time out to answer some of those questions. Because being on the patient side of it, there's a lot of things that they just are unaware of, or they'll wait, just like you said, and don't address issues appropriately or timely. And so you two better can identify some disease processes that you think should be highlighted, something that maybe the community is just it's commonly seen in your practice, right? And it's just something that they don't really think about, or they don't identify what that potential outcome could be. So I'll start with you. I call you Dr. Tiff. So I'll start with you.
Okay, so I'm big on facts. I mean, I think we all are, just from our didactic background. And I want the people to know that's live right now, that's watching, and the people that will watch the playback, that right now in our country, there's over 630,000 deaths due to heart attacks, okay? And I'm starting this off because I see many of these patients in my practice. They have come to me, they just suffered their second heart attack. They just suffered, another stroke. And it's very near and dear to me because unfortunately with my first child, I developed preeclampsia. So I know how it is to have high blood pressure. You have to take labetalol or whatever type of hypertension medicine you need to stabilize yourself. But in particularly amongst the Black community, I really see it, and it's just troublesome to me. It really breaks my heart because it's a cycle. And what people don't realize is that 50% of those heart attacks are caused by dental infections. Okay. So I'm the dentist where if I have a parent come and bring their child to me for a dental exam and there's multiple abscesses, I'm cutthroat. I tell them about the DMT driver story. I don't know if you guys are aware of that, but that was a young man. He was like under the age of 15. He did not have dental insurance, unfortunately. And he passed away due to a dental infection, a tooth infection that was preventable. So I want people to realize that the infections in your mouth that you ignore or you neglect, they can cause serious harm and danger to your systemic health. And, you know, me and my colleagues, we say all the time, like as dentists, we're the physicians of the mouth. People don't realize how important it is to maintain good oral health. A lot of the time, some diseases can be actually diagnosed via the oral cavity first. And so going back to those heart attacks, the 50% of them that could be preventable is through, you know, preventing gum disease. Gum disease is an infection of the gums. If you go to get your cleanings at least 6 months, that could help prevent that. So little things like that, like educating, you know, your patients, the population, doing community service, like, you know, health outreach. It's important to educate people because they don't understand the symbiotic relationship of the body. Like all of our organs actually relate to each other. And I brought this because it's a medical consultation request. And I don't know if you do this, Dr. Thompson, but if I have a patient who has diabetes, if they just recently had a heart attack, a stroke, if they just recently had any cardiovascular surgery, if they are on any medication to help with hypertension, or if it's unstable hypertension, they have to get a medical clearance. And some get mad, but I'm really adamant about this because I had a patient. She came in for extractions. Her blood pressure was like 220 over like 125. And I don't know if people know, but the more ideal range is like 120 over 80. So when I see someone at 220 over 125, that's a hypertensive crisis. And we called the EMS. Thank God we did. The patient called back a couple weeks ago, you know, after that incident and said, "Thank you so much. I stayed in a hospital. They actually found a blood clot in my kidney." So, you know, patients get mad because we ask so many questions, but that's because we're actually concerned about the systemic health. Everything relates to each other. If you have high blood pressure, that's because your heart is pumping overtime to send those blood vessels, to send the blood to your toes, to your extremities, to your heart, to your brain. Eventually your heart is going to get tired, like, all right, now it's only so much I can do. And it concerns me because these things are all preventable, but within our community, it's not being discussed. So I just think that it's important, like, to have IG Lives like this, to have health fairs, go to schools. I really think it's important that schools have more oral health education, more fitness programs, you know, tying into you, Dr. Thompson. But I think it's just the lack of knowledge, you know, or sometimes it's just the resources that are not being provided. That could be a social economic issue. I'm not sure, but it's up to us to ensure that everyone is afforded the opportunity to have a proper quality of life. So just going back to what I was saying, I see a lot of patients where the conditions that they're dealing with, whether it's kidney failure, hypertension, people don't realize diabetes is closely related to periodontal health as well. Like if you have an unhealthy oral cavity, then your diabetes is more likely to be out of control. So if you have a healthy oral cavity, then your diabetes is in control. So it's so many things that's related that we need to have more discussions about, but we just don't talk enough about it.
That's really powerful, and you really hit on some key points. And I also encountered preeclampsia, and to encounter something that really in many other situations, it's very preventable. In African American in our communities, that's something that is the silent killer. It leads to strokes and many more complications, and it's something that could easily be prevented with screening and early treatment and lifestyle modification. I know sometimes there's an idea that healthcare providers are just eager to want to prescribe medications. However, I'm always like I'm big on nutrition. I'm big on lifestyle modification. I'm big on managing your weight. Reducing weight can also improve some of those, conditions as well. So back to you, Dr. Thompson, what are some disease processes that you think need to be addressed within the community and need some awareness?
Everything that you guys have said is definitely something that hits home in physical therapy, because once a patient goes to their primary doctor, or their family doctor about an issue, these things are being reinforced by us because, again, we're a whole person. And although you have knee pain, that knee pain is arthritis, probably the biggest thing that we see is, arthritic changes. But why are our joints degrading? They're supposed to. And I have to explain that too, that like, I don't understand. I have, even 30-year-olds, they're like, why do I have arthritis? Well, you're active. Your joints are going to break down. But you can help preserve some of those things by your diet, by your weight, by what you put into your body, your stress levels, those things that you're around. You have to manage all of that. I can't just fix your knee pain if you're doing all this other stuff outside of when you come see me. The biggest problem I see from patients is they neglect everything that was said by their family doctor. And then we come back and say it, and they're like, oh yeah, my doctor just said I need to stop smoking. Well, yeah, because you come to me and you didn't already smoked a pack, and that's reducing the blood flow to your joints that we're trying to heal. So you're not helping the process. So I think it's very important
to back off with the smoking.
What was that?
Yeah.
That's so frustrating because we tell patients not to smoke, and then they go and get a dry socket, and they don't realize the nicotine is a vasoconstrictor. It reduces the amount of blood flow to the area, so you don't even create a blood clot. But it's about educating them.
Right.
But I didn't mean to cut you off. But
no, you're okay. It's a big pet peeve of mine. A very big pet peeve. And now that especially everybody is for marijuana and great stuff, and you come in, it's that's helping with my pain. I hear that all the time. Well, that's what I use to help with pain. But yet and still, it's still a vasoconstrictor. It's not helping us right now. So don't do it 20 minutes before you come to therapy. But the education is the biggest piece. Arthritic changes is my soapbox that I stand on, because people think that if I hurt, I should not move. And that's totally wrong. You need to move. The problem is you're not moving enough, most likely. The other issue is that you have the other realm of patients that say, well, no pain, no gain. And again, that's not necessarily true too, because pain is an indicator. There's something wrong that could be causing a problem. And so if you're overdoing it, it's a problem. And if you're underdoing it, it's a problem. It's a sweet spot that we have to find. And we can't find that unless, we try some things out. And it's a lifestyle. As we get older, especially, you have to continue to move and do a little. Unfortunately, you may have to do a little stretches every now and every day to keep things, nice and mobile. I see so much now. The great thing is that I get to work with patients in the clinic, but I also get to see athletes. But I see such a revolving door of patients coming through therapy because they didn't keep up with what I told them to do 3 months ago. So you're back again with the same pain because you didn't do the exercises I gave you. Well, I got, busy. I was feeling better, so I stopped. Well, that's not the case. You shouldn't stop, because you have an arthritic joint that's only going to progress. Now, we can slow down the progression by making sure that you're protecting those joints. But people don't necessarily get that concept. And I think if we educate more and really tie in the holistic approach to healing, then I think that patients will be on a better page. But I think it's as a medical community that we have to come together and make sure that we're saying the same thing. I know that we are so, unfortunately, in the healthcare business now, it's so fast, and you don't get a lot of time with patients. But if we're saying the same thing, it'll click. It's just we have to continue to go out to having these discussions, having health fairs and things of that nature, so that we make sure that we're accessible and making sure our community know what's going on. Because I think we get looked over, unfortunately.
That is some very powerful and insightful information. I think that when you have a rapport with your patients and you develop that trust, then they are more willing to, accept that guidance and trust you. And it's so rewarding to have someone that looks like you, that's a provider who there's no language barrier. And sometimes that helps bridge that gap and that trust. And so you guys really hit on some major points. I always speak about the tobacco and how many poor outcomes result from that. And so that is something that's key too. I think that these discussions should happen in this setting, because it's something that's very easily accessed. I mean, it's virtual, so you don't have to go to an event, or you don't have to actually go anywhere. You can access this in a virtual platform. So that is major. But I really appreciate you for chiming in and giving the community some information about, things that they just did not understand or aware of. But transitioning to success, many people are just excited to hear about what are some keys to your success. Both of you are very successful, highly educated. Can you tell me what influenced you on your journey? What advice you can give to women that are really trying to grind, really trying to have a mentor, really trying to, be successful? What do you guys feel about that? Chime in.
So I would first say, I always knew that I wanted to give back and help. I just didn't know how I wanted to give back and help. So when I was at Michigan State, I actually joined the Charles Drew Enrichment Program. I don't know if anyone on this live has ever heard of that program, but Charles Drew was actually the first African American to figure out how to basically, if you were in a car accident, how do you, store this blood so that way you can, give a blood transfusion. So the program was very insightful. They actually would bring in people from all professions to our class, and every session we learned about somebody new, a different profession, different forensics, just a wide variety. I think it's important to expose yourself, whether you do it through college or through trade school or through shadowing. The only way you know for sure what you want to do in life is actually shadowing someone and actually observing and actually trying it out, getting your hands dirty. Because there's nothing worse than starting, a journey or a career path and you find out you don't like it. So I would encourage anyone who is passionate about something, especially to the people that's doing basement braces. I can't stress this enough. You are talented, you are smart, and if this is something that you're passionate about, go in and work at an orthodontist office and actually, learn the ropes, and then maybe eventually you can, apply to dental school. But it's so many smart and intelligent people, they have to just apply themselves. I feel like right now our society, they just want to take the short route, and in the long term, you're going to end up hurting someone else or yourself. And it's not worth it. It's so important to really know the technique and methods for how to do something properly and efficiently. So one thing I would definitely encourage people to do is that if you know you're passionate about something, or if you don't know what you're passionate about, just go out there and explore. That's the only way you would know. Do summer programs. When I was in undergrad, every summer I went to U of M. They had a Profiles for Success program. That was people who were interested in dentistry and medical. And you had to choose which path you want to take. And that was an excellent opportunity for me to meet people that look like me who are interested in medical and dental. And I can say to this day, most 90% of those people in the program, we're all either doctors, we're medical doctors or dentists. And it's just amazing to have an amazing network of people that I knew when I was 17 and 16. And you know, all these people that I've met very young, those are lasting relationships. So, you know, I can call them up, ask them about something. It doesn't feel forced. So I would just encourage people to just get out there, shadow. Don't be afraid to network. Don't be afraid to, you know, if you have a doctor that you're interested in, you know, establish a rapport and a relationship with them. That's one of the first people who will let you shadow them. So I just think that the first thing that you need to do is, you know, get rid of the fear. And if there's someone that interests you, walking up to them, talking to them, and building a relationship is really important.
For me, I think that that's, I mean, basically pretty much what I've done. Mentorship is key, and staying curious. And I think those, especially in medicine, are those type of personalities where we're always thinking and wondering why. And if you keep that same wonder, you're always searching for explanation of something. If it's, you know, challenging your patients, if it's a different treatment method or whatnot, that curiosity brings forth evolution, and you will never get bored. That's what the best thing I love about medicine. You know, some people use, well, you know, doctors are just practicing. They use it as a negative connotation, but yeah, we are, but you know, our world is changing, our patients are changing, individuals are individuals for a reason. And so you cannot apply the same method to every person, and you need to say that same thing for yourself, because you can't be like me. You know, I tell my students, like, you know, find out who you are and what you want to do. There's so many different specialties that you can go, especially in rehab, and see what fits you. You have, just like Dr. Tiffani said, you have to try it out. You have to go shadow. You have to talk to people to see what you want to do before you waste money, one, and then time. You're not going to get that time back. And it's okay if you don't like it. You know, and it's okay that you make some mistakes and you have to kind of reconfigure things. And that's, I think, the biggest thing, at least I see with kids now. I won't call them kids, but a lot of my students are just like, I want to do this and that's it. And if it doesn't work, then I'll just do something else. Well, yes and no, but still try to pursue. You know, you still try, and you try to make it work, what works best for you in your situation. And I believe, again, if that curiosity stays, then you're going to always be successful.
And I think it's very important to be organized. I think most of the people that choose our professions, that's just innate. That's in us. We write everything. I know for me personally, I like to write my goals down, and I like to check them off because I need to see them. And I might do a daily goal sheet. I might do a weekly goal sheet, monthly goal sheet. I might do a year-end, you know, review. But I think it's so important to be organized, and you have to know the steps to take. You have to do the research. You cannot rely on anyone else to do the research for you. Because I have so many people that approach me about, you know, the public service loan forgiveness or the National Health Service Corp. And I don't mind giving them the information and the websites, but you have to do some research yourself, you know, because if this is your passion, I can see this as your passion, you know. But I will say this, you know, once you show me that you're passionate and you're willing to do it, I'm willing to help in any way I can too. So that just goes back again to just having a mentor that you can rely on when you feel like you just, you don't even have it in you. You don't know which step to take. So we gotta, you know, put our pride to the side as my husband tells me sometimes, and ask people, ask people, and but you have to show effort. You have to put a foot through. You can't just expect them to hand feed you the entire way. So I think showing effort and actually doing research first is key too. There's so many different networks. It's like studentdoctor.net. It's so many different online networks for you to do research first, because when you approach someone, they want to see that you have actually researched the field or the topic. You don't want to just come to them just mumbles and numbs the word. You want to have something for them to give you feedback on. So that's really important. Do your own research.
Well, that's powerful, and I agree. I feel like when you have a network and a community, and knowing that you have people that you can access that are willing to precept you or mentor you, that's very important. But you have to, come to the table with skills, and that just having ambition. And like you said, there's so many different platforms where you can access this information, and so just show some effort, because then you realize that you're pouring into this person, but they're actually going to benefit from what you're doing, and they're actually going to utilize those skills and try to advance in what they're trying to do. So that is very powerful. I always try to encourage networking. Many people say, I don't have the personality. I'm not a social butterfly. I'm an introvert. That's fine. You can be all of those things, but you need to understand, if you have dreams, if you have goals, you have to step out on faith. You have to do things that you've never done before. So step out of your comfort zone, get off the couch, get out, meet people. Yes. I would consider myself not to be the social butterfly, although people think that I am. But I had to develop that. And with maturity, you understand and you realize you meet people on your journey, and you never know who you'll need. So always make sure you foster that communication. Make sure you treat people right, because you never know. I've encountered people on my journey where I was just a nursing assistant, and some of that communication wasn't so kind or pleasant. And then now I'm the person that, could pretty much interfere with them being hired. And so just always, try not to burn bridges, respect everyone regardless of their status or what their position is. So that's important too. You never know who you're going to run into later on your journey.
I think it's also important. For sure. Everyone would tell me, or everyone that I work with, they say, "Dr. So cool," because I don't care about a DR in front of my name. I don't care about a DDS. I feel like we all have a purpose, and the thing is, I feel like you can always learn from someone. I don't ever want to feel like I can never receive constructive criticism. The only way to really get better and improve is to be open and to hear insight and suggestions. I tell my assistants all the time, if you got any suggestions for me, please don't hesitate. Please let me know, because I always want to make sure I'm improving. So that's something too, where you can never feel like way up here, nobody can tell you anything. You have to always be open to hear what you can improve on. No one is the top of the top. No one. And you can fall real quick. So I think it's important, that's why continuing education courses are required for us to maintain our licenses, because technology is forever changing. Methods and techniques are always changing. And you always have to be open-minded, and you have to receive change. The only thing that is inevitable is the fact that change is going to always happen. We can't help that. So I just think going into any profession, if you want to be the best at it, you got to be able to receive constructive criticism, and you got to be able to accept change. And I tell everyone that's interested in dentistry is a very fast-paced profession. Someone might have a treatment plan from 6 months, and now they're in pain. Now you got to hurry up and switch up the treatment for the day. So you can't be easily frazzled. You have to know how to have a poker face. I think that's with all professions.
Right.
You got to know how to have tolerance. You have to know how to maneuver. You got to be a trouble seeker. You got to figure out how to fix this problem, all the while maintaining a poker face. And that's what my friends, they say, you are so nonchalant. I have learned, that's just how I've learned to be. I'm sorry, because in my profession, the moment I look like, ooh, what's going on? It's a problem.
Exactly. Because they're looking to you for the answer. So if you don't
know what
that's
what that is leadership.
Yes.
That is leadership. And that's really important when you are able to approach a situation with that calmness. You're able to use your discernment. And I tell people, you can have education, but you also have to be able to be a leader. You have to be able to communicate with people and use your discernment. That is also a great guide to have and use. And so, and I listen to my patients, you know, I tell them this is not a dictatorship. I want to know what you're feeling. I want to know what, you know, concerns you have, because this is communication that needs to happen. So I think that is very important and very impactful. But ladies, I just want to know, just for it to be clear, if there is someone on this live right now and they're feeling overwhelmed, or they feel like they've been met with so many different barriers, or people are being condescending and discouraging, and they don't feel like they have that family support. Some people don't have the mama to show them, you know, what curriculum to pick, or they don't have that father support. And so what do you want to tell them that you think that they could walk away from that feeling like, you know, this is something I can do. This is something that I can accomplish, you know, because it's important that we use our platform to amplify, you know, voices within our community. So what do you think would be powerful to tell them right now?
Well,
for me, I think that, oh, sorry. Go ahead. For me, I think it's important that, you know, you always, you know, I'm a very spiritual person. I love Jesus, and that's who I, you know, sometimes I can't talk to my husband. Sometimes I can't even talk to my parents. And that's where, you know, that's where I go. Now, some people aren't at that level, and that's fine. But, you know, finding someone that you trust, that you can talk to, whether that is a psychologist or a therapist or anything like that, is key. Because one, you know, we all get in moments that we feel overwhelmed and that you're discouraged. I mean, it's inevitable to have those feelings, but in the same, I think it's, again, like we are always trying to strive to do better, and we can't stay there. You can have your moment, and it's okay to have your moment. And I feel like, you know, especially as Black women, we have to always kind of, you know, suppress some of our feelings, because we got to go. We have to be strong. We have to be that person that is there for everyone a lot of times. And sometimes that's not, someone needs to be there for you. You need to take care of you, and use strategies that will help you not feel overwhelmed and discouraged, but also, you know, seeking out that assistance from someone else that's professionally knows how to deal with those areas and guide you through that. I am very, very for prayer, meditation, you know, trying to get myself into a space where my thoughts, you know, your thoughts can eat you alive. You know, you can get in such a place where you are just, you know, so bombarded by life, and you're so beat down. I know in these last, you know, 3 years with the pandemic, I mean, we're seeing it now. You know, we're seeing a lot of that now. And, you know, you have to be able to get to a point and shut those thoughts off. Because you are successful, you are beautiful, you can do all things, but you have to be able to get out of that. And sometimes we don't know how to get there. So professional help is always my go-to. And I, you know, you got to call on the Holy Spirit. I'm sorry, I don't want to preach, but you know, I pray, and there's the words that I don't know or what to say, He does. And He helps me kind of guide my way through that. But having support system, and if you don't have that support system, again, seek out the help. I mean, you have doctors for a reason. I have many times have, you know, referred patients to get help, because I can't help you if you are not even in a headspace to deal with your injuries or your pain or things of that nature. So we got to get that together.
And what about you, Doc?
I totally relate, and I piggyback everything Dr. Thompson said. I think it's important for people to realize, even after you have matriculated and you have received these accolades and these degrees, we still go through stuff. So that's life. You're going to go. Sure. We are living in a sinful world. We are going to go through things, and it's not, about the things you're going through. It's how you bounce back from it. I think that's the most important. So for me personally, I find it very edifying and fruitful for myself when I listen to podcasts. I love YouTube. I just love all the amazing resources it provides. I love listening to like my Sarah Jakes, I love listening to all these wonderful podcasts where it's women discussing that, hey, I'm going through stuff too, like to hear other people, they are also going through things in life. It makes you feel like, okay, I'm not alone. So I think it's so important to either seek, like you said, professional help. If you're like me, I do have a therapist most recently, but it's still very weird for me. It's very weird for me to just pour it all out to someone who doesn't know me. But I have to keep in mind, just as I was professionally trained to be a dentist, and I know for my patients, I want to do the best for them. That's how I have to consider the therapist. They're trained, this is their profession. So if you're at the point where you might break, that's when, to me, professional help needs to be included. But if you're not at that point of like suicide or self-harm, then, podcasts, motivational music is very important. Writing out like gratitude letters, like writing out, well, thank you, God, for doing this for me. Even though I had this little mishap, I still have this, writing out a list of things that you have overcame, and then figuring out how you can overcome these current issues. I think that's important because we all get in the dumps. We all do. But I think after you have cried it out and, you have felt that moment, because it's important to feel it. I think if we just keep going and not actually feel and embrace that moment, that's when we crack. So you have to actually take it in, think about it, and then the next step is a solution. Like, I'm all about hearing what's going on, but I'm gonna need to hear a solution too, and me and my friends were the same way with each other. Like, okay, tell me what's going on. Now let me tell you what I think, or do you want me to just listen to what you think you should do? So, it's just important to have girlfriends around you who support you. And I understand everyone might not be blessed to have, a group of friends who they feel they can trust and tell their information to. But even if it's just one close friend, that's all you need sometimes. But again, I first go to Jesus. I'm with you on that one, Dr. Thompson. I listen to the music. I listen to podcasts. I write down what I'm grateful for. And again, you should write down a solution, a way to get yourself out of it. But you got to remember, there's always going to be some rain. Always. It's always going to be an issue. And that's why, for me personally, and I forgot to bring this up in my story, but that's why I came out with this book. I don't know if you can read it, but Purposeful Imperfections, because I feel like with social media, we are all seeing everybody's like end goal. You see everyone in their profession. You don't see what it took for them to get there. And so people who are interested in that profession, they're comparing themselves to someone who's been doing this 10, 15 years. That's and you can't do that. So I really do, there's a scripture that says comparison is the thief of joy, and it is. And I think we all
that's true
have a little bit of that inside of us, to be honest, because of this social media world. I mean, when we were in high school and when we were in college, there was no social media. I remember going doing research overseas, and that's when Facebook first started. That was like, 2005 or so. Yeah, so like
3,
I'm
4,
grateful
yeah.
that I grew up not really having social media because I didn't have to compare myself but to everyone that I just saw in front of me. But you really shouldn't compare yourself. If anything, that should be a motivator to you. I love seeing women succeeding. I mean, to me, I love having friends from all backgrounds, from all stages of life, because I feel like we can all learn from each other. You know, and like they say, you should never be the more successful person in the room or the most financially stable. I just think it's really important to really just know that everyone is struggling. Everybody's trying to figure it out. You know, we all want the best for ourselves, and just know that you are not alone. I think
now it's important that you said that, because I do want to really like tap in and kind of, before we wrap it up, is how significant do you think diverse representation is, especially for African American women, right? Because we know that less than 3% of African Americans have access to $1 million funding for businesses. You know that in terms of the healthcare industry or ownership of different healthcare facilities, clinics, dentists, you know, what about the representation, and what has that done for you? How has that been impactful? And because I think it's important to utilize these platforms and strategic collaborations, right? To really highlight how impactful we can be, how successful we can be, because I've been saying, you know, try to do collaboration over competition. It's necessary. We don't have to compete. We could work together and we could be stronger. We can network. So how has that been important for you?
Yeah, go ahead.
For me, I love the, you know, I think we do. We always say, yes, we want to collaborate and we don't want to compete. I feel like within our community, though, you know, we say it, but we don't mean it. I mean, at my job, I am the only Black female senior physical therapist throughout the entire system in outpatient therapy, sport. And so, you know, I get a lot of requests from patients like, I want a Black therapist. I want a Black therapist. We have Black therapists, but it's only a handful of us. And I think it's great, yes, you know, that we have people that look like us, because we have that common language. We can understand each other a little bit better, but then also we can help our colleagues as well, because we all have biases, and helping them recognize some of those biases as well, because they don't get wild. You know, they're always bringing me in because the patient didn't call the other therapist racist. So it's like, well, you shouldn't have said it that way. And, you know, we sometimes as patients, we use that as a defense mechanism as well. But it's definitely very important. It was important for me to see successful women, Black women in therapy, and especially, I mean, when you get to sports therapy, I can't even tell, I can probably count how many there are. And especially at a higher level. And you have to think about that too. You're dealing with a lot of orthopedic surgeons, and the majority of orthopedic surgeons are white male. And to be in those rooms, and, you know, I've had people say, well, I get intimidated being around people that have degrees or people that are, you know, smarter or things of that nature. Heck, I can understand to be in these rooms with these people, but I'm in the room.
Amen.
And you don't let that intimidation, you know, stop you, because you have to fight. And unfortunately, we have to. We have to be able to represent ourselves. But I really want us to do better as a people of helping each other. On the side, you know, I do wine. Well, I'm a winemaker. And so in that aspect as well, there's 1% of winemakers that are African American. 1%. You know, and that, I mean, it's a major market, but there's only 1%. And you take a Black female,
which is
powerful, to make wine. I mean, the doors. Yeah,
that is amazing. Yeah,
you know.
Yeah, but
you know,
and people, when you're telling people this is something that you're doing and you're launching and you're experiencing, the next woman is going to say, "Well, if she can do it, I can too," you know. And so that's why representation is so powerful. What about you, Dr. Tiff?
Yeah, I at first, I have to be honest. So when I was in dental school, My class had like 137 students. It was only 5 of us, 5 African Americans, 1 Black male. And I felt like I constantly had to prove myself. And in doing that, I'm not going to lie, it became me, it allowed me to become very proficient and efficient at my craft in the field of dentistry. So that extra push for me to have to prove myself, it actually helped me be really good at it.
Yes.
But it's just sad that we have to feel that way. You know, it's sad that we feel like we got to just go over and beyond to prove that we're supposed to be somewhere. But I will say, being a Black woman and a general dentist is advantageous. I'm proud of it. Like you said, patients will request for, you know, a Black female doctor. And then also, I think it's important, like I said earlier, for people of different races to see me. You know, there's so many negative stereotypes on TV, you know, and I just want them to know that we're multi-dimensional. We're not all the same, and we can be very intelligent. We can be admirable. We can be important people to society. We can help the healthcare system. And I think it's important to have representation in all fields, because like you said, our colleagues that are of different races, they just don't know. They really don't know that what they're saying or how they're saying is offensive. And, you know, that's why, you know, I actually have to tell a colleague, the patient doesn't trust you, and it's because of the Tuskegee, you know, syphilis experiment.
Exactly.
And he did not know what that was. And I was very upset, because you should not be serving African Americans and not be aware of the Tuskegee syphilis experiment. And so, you know, just bringing that up and making them realize why people have such an issue with certain treatment plans and the way it's being said, it's because, first of all, you don't look like them, and so they're already on defense, or, you know, they don't know if they can trust you. They don't know if what you're telling them is a money grab. So, you know, me just being able to say, hey, look, this is what's going on, and I can talk to them, you know, without any preconceived notions. That's an amazing feeling for me, because, you know, I know they trust me. I could just see it in the way they smile and the way we have a dialogue. They're like, okay, Doc, I understand now. I'm willing to go forward.
Like they get it.
Yeah, they get it now. But I think, you know, I show my patients their x-rays. I say, you know what, you see this black spot right here? This is a cavity. I don't think a lot of other providers may do that. And I think it's important for providers to educate patients on their own teeth. It's their teeth. And so showing x-rays, you know, and actually explaining to them and educating them with diagrams and pictures, that's a way to get a patient to trust you. You know, you can't,
and bring it to their level.
Say all these words and then expect for them to want to buy into your treatment plan. So it's important to communicate and talk with people and show them.
You guys really hit on some really key points, and I really think that this conversation was very powerful, right? Is there any pressing questions that we can answer? Because I know we didn't like alternate and jump in, because we just are so passionate about what we're talking about. We I mean, you can kind of tell, you can separate people who are in it for money, and you can tell who, you know, the ones that really want to, you know, have an impact, the ones that really want to improve outcomes, the ones that really want to touch our communities, the ones that really want young women that look like us to know that they can have goals similar to ours, you know, and to reach out for mentorship. Is there any questions that we can answer? We'll be wrapping up shortly, but I do want to at least, you know, ask Dr. Thompson to speak a little bit about, you know, her show that she's premiering soon. I love it because it's representation. It's needed, okay? And so that's important. Like, we want to know, you know, a little about that, but any questions that are pressing, because we're going to have her talk about that. And then we're going to wrap it up with a Bible verse, right? Because we are women that you know we're spiritual and we love God, and that's the person who's guiding us through the decisions that we're making on our journey. And so we have to give respect to him as well and highlight him, because of him, that's why we're holding these seats, and that's why we're on this platform. And that's powerful, it's impactful. And so we just have to, you know, take a moment and say that. But
definitely,
I don't see any pressing questions, but please tell us about this show, because I am so excited. So excited. When Dr. Tiffani told me about you, I was just like, that is perfect, right? So yes, because it's about representation. So what better way to have a show with millions of people that can tap in and understand what goes within the household, and what goes on in a household with, you know, a woman that has, you know, her career going and just have a lot of purpose. So go ahead, tell us about it.
So what I love, I'm a cast member for Love and Marriage Detroit. It is on OWN Network. It will be premiering this Saturday at 9 p.m. What I love about the Oprah Winfrey's Network is that she is so about Black excellence. Now, you know, it's reality TV, you know, so it's reality TV. But she loves the fact that, you know, we are striving and building, and then to also showcase Detroit in its best light. We're navigating marriages and relationships and showing how we do that, and all its nuances that come along with it. So it was an opportunity that came, and my husband is the extrovert. He is the one that loves it all. I gotta leave him out down here that's crying now. I'm sorry. But me on the other hand, I'm like, okay, but it was fun. It was definitely fun. I'm excited to see everything, because I haven't seen everything.
So you're
watching, I'm excited for
and this is going to be airing in what? We have 2 days.
I saw some snippets.
We have to wait 2 more days.
Yep, Saturday.
I'll be tuned in.
Yeah. So I'm excited, nervous. Great couples, great conversations. But I mean, you literally see us navigate life. And how that looks. And, you know, for so many, you know, with marriages in particular, we give up so easily. You know, marriages work. It's always going to be work. Me and my husband will be married now for 15 years in August. It still works, you know, and you got to work at it. So
that is true. And so you highlighted your book, which is something that is amazing to be an author. Can you tell me if there's any other things that you would like to highlight?
Right now, just at this moment, I am just loving being a mother. I'm loving that. I'm grateful to be in the profession that I prayed for so many years. Just looking forward to just being a vessel and continuing to give back and help as much as I can. And I'm continuously, you know, mentoring specifically young Black women to go into the dental field. I just recently had a mentee who's a soror, Dr. Thompson. She's AKA. She just graduated as a dentist from Mahiri, but I've had quite a few women who have progressed and now they're doctorates. So to me is what brings me joy. That's what brings me so much happiness. Just to know that it's not just me, that, you know, I'm in this position. I'm actually bringing other people along who are really passionate about it. And it's not about us. It's about how many people we can reach. You know, I can't reach I can't reach people in California. So if I got a mentee who's reaching out to me through social media, that's amazing for me to be able to give her some nuggets to actually go through this career path and actually excel in it. So you know, it's like the body, you know, I could be the arm, it could be the leg. We all got to work together to really give back and serve God's people. So I just think it's important to really, you know, give back. Don't be selfish with knowledge. Really help people, and we all can succeed. You know, it's not just, I don't have a crab in a barrel mentality at all. I think it's important to see all of us, you know, thriving and actually fulfilling their purpose in life. And so that's really what my book is about, is, you know, just trying to give some keys and tools to what I utilize to get through like dental school and stuff, even despite the medical issues I was going through. Dr. Thompson was my physical therapist. You know, it's just like everyone goes through something, and I'm grateful for her too. I would leave work and she would come and stretch me out. So you just don't know what people are going through behind the scenes. And you know, we just keep pushing forward. We're so professional and keeping pushing forward and maintaining this exterior. But just know that, you know, we all have our own issues, and that's why I love the scripture, you know, Philippians 4:13. That's my ultimate favorite scripture. You know, I can do all things through Christ who strengthens me, because when I'm feeling the weakest, you know, I somehow muster up some strength to keep it going. You know, having 2 young children, being a wife, a professional, full-time professional, it's a lot. It can be exhausting. And, you know, as a woman, don't forget to have your self-care days. You really got to make time for yourself. And get dressed up, look cute. I feel like when I feel dressed,
it makes a difference. What about you, Dr. Thompson? What is your verse that
for me, Philippians 4:8, which really just says, think on these things, those things that are good, pure, because again, out of the heart the mouth speaks. And you know, whatever you are putting in, that's what's going to eventually come out. So to always meditate on the things that are good. There can be things that are, you know, not going great in your world, but I am a firm believer in having positive thoughts and making sure that, you know, I'm just not going to dwell on that, because what's the point? What is it benefiting me? So, you know, think on those things. And then he comes back to say, you know, when you do this, then I will do this. So if you are focusing on what is good, and all things work for your good, then you won't have any issues. You know, despite every situation that you go through, you can find some good in it. My mom will always say, there's always good, always. No matter what the situation is, there is good. You just have to find it.
And it's important to have people around you who are not negatively. You know, that people. If you have people around you with that negative tongue, I mean, it's not going to help you at all. So you not only need to speak good, but
remove yourself
around you need to speak good things too. That's so important.
And so Proverbs 3:5, and it talks about trusting in the Lord with all your heart. And so it's important to, you know, submit to him. Don't lean on your understanding. Know the power of God and how he can guide you and how he can lead you. And so I think that's something that I've had to really understand, and with maturity and with spiritual maturity also, when you identify that, that's something you can strengthen over time and help guide you for your mental health. Mental health is so important. Peace is so important. And like you said, having positive people around you, it can really change your life. Because it's going to be powerful. It's going to be motivating. It's going to, you know, give you that energy, that powerful perspective, right? And so changing your environment is key. And people really don't realize how important that is. But I feel like at the end of the day, when you use integrity, when you're making your decisions and just trying to treat people the right way and utilizing your platform, if you can, to, you know, reach out and inspire other people from all different walks of life. But what tonight we're talking about is representation among the African American community. So that's what we're talking about specifically tonight. So I really, really enjoyed this conversation. I hope to see you guys soon. You guys tune in. If we have 2 more days. 2 more days.
Please. 2 more days.
And so it's very necessary. But is there anything else that you would like to tell anyone? Someone says that awesome discussion. You ladies are truly inspirational, and to God be the glory.
Yes.
That was perfectly said.
That was
Thank
perfect.
Thank
And,
you.
I just want to say thank you again, Dr. Natasha, for initiating this awesome discussion, an opportunity to just shed some light on certain things and allow, you know, social media to like really hear us have just a really natural dialogue about things that we feel. So kudos to you for, you know, initiating it, you know, listening to that little voice in your head or that whisper that tells you to do it. So kudos to you, and thank you again for inviting us to this, you know, awesome opportunity.
For sure. Yes, thank you so much. I love this, and the thing is that you know, we can use social media in such a positive way, and it's a cultural mountain that it has to be addressed. These things have to be addressed, and the ability to use these platforms to educate, but also to give God glory, is always the ultimate goal. So I thank you for, you know, reaching out, and I'm apprecitive of you ladies as well.
And she also stated, life's a marathon, continue to run with purpose. We need to follow her. I can't, it says run really.
Oh, that's my mommy.
Oh, your mom was the, oh, I'm like, wait a minute, I like that. That's who I follow. I want to see positivity. Yeah, I can tell just off those 2 comments that was someone powerful, that was someone positive, that was someone that will motivate you, and I'm going to follow you when I get off here. All right, ladies. Good night. I will share this. Okay.
Very good night.
Bye. God bless.
Thank you.
Thank you.